The demineralized bone fibers, or DBF, are a strong preference in my clinical practice. The demineralized bone fibers combine both osteoinductivity and, in fact, the highest level of inductivity because there's no exogenous carrier. This is 100% demineralized bone. And it also has the capacity for osteoconductivity because of the fibrillar form. And I find the product to be quite useful in terms of handling properties. In my hands, I prefer to mix the demineralized bone fibers with bone marrow aspirate, and I can place this within an inner body cage, I can place this in the inner body space, or I can use it posterolaterally. It maintains handling properties in the absence of a carrier, and it has really an optimal content of osteoinductive materials. So I find the DBF product to be very clinically effective and useful in my practice.